I really enjoy being a dentist because my favorite thing is the relationship I have with my patients. We see people for years. We were looking for a place to start our family, and my wife's a dentist also. I was in the Navy. We could go anywhere in the country, actually. And we decided to come to Stoneham because we had a Catholic school in town. My wife went to school in Italy. Now I'm very much involved in our church and our community, and that's the conduit which we started. Pretty much if my patients are involved in it and they come to me and ask me to support them, we're there to do it. They're supporting me, I support them. It makes more relationships in the community, and I really enjoy it. We're here Monday through Friday. We work until 7 on Tuesdays and Thursdays. We work until 6 on Wednesdays. I have an associate who's been with me for 10 years. Her name is Dr. Angela Karajanis. We have 4 hygienists, 3 assistants, 3 office personnel, an office manager. My wife, Dr. Silvestro, also handles a lot of the office paperwork and insurance and overseeing all of that. So I can really focus on what I love doing. I love doing good dentistry on people, bringing them high technology. We brought all the technology to allow us to do things in-house, get things done quickly, shorten your visit time, lower your cost, and you're recovering much more quickly. Fewer visits, less expense. We use technology called CEREC. It's very new. The technology actually has been around for about 10 years, but we always have the latest version. This is one of the latest additions at Family Dentistry. This CEREC MCXL produces restorations, crowns, bridges, and veneers right on site in 5 to 10 minutes. The patient can wait and they can have the restoration milled. We go from virtual to reality. Kind of reminds me of the, everyone's seen American Chopper when they cut out those wheels? Well, we cut out custom-sized pieces of porcelain right here. We have technology for just about every facet of dentistry, from the minute you walk in the door to the minute you leave. When you're alerted to come here, we send you a text to remind you, an hour before your appointment, several hours before your appointment, we can send you an email. People really like the reminders, especially us men. We tend to get a little absent-minded, I find. Basically, everything a general dentist can do, and a lot of specialty dentistry we also include. We do all routine restorations. We do crowns, bridges, implants, which is a little outside some of the general dentist scope, but we like to do implants, periodontal surgery. We treat children. If a dentist can do it, there's a good chance you can have it done in family dentistry. The last thing a person wants after we've developed a relationship is to leave and have to go somewhere else. So once they come in, I'd like to know that we can take care of everything. Everything from the paperwork to the final treatment. When I first meet a patient, the first visit is so critical. I talk to the patient, I talk about where they are, where they want to take their treatment plan, and then what they can then legitimately and comfortably afford. I always tell patients that are overwhelmed, you didn't get here overnight, we don't have to get you out of it overnight. We can make this comfortable for you. I want you to, you're going to be a patient for many years, and we can fix you over several years. We don't have to fix it overnight. We can long-term plan, keep you out of trouble, maintain your teeth, keep your health, and not have these emergencies and these problems that get you out of care or make you uncomfortable and make you afraid to come to the dentist. Our patients know if they call our office and say the magic word, "I'm in pain," we will see you that day and almost immediately. You may not come in and see a dentist immediately. Somebody will see you, the dentist will examine you, and we'll make sure that we can get you out of pain before you leave us. You need a dentist because it's like driving your car and never changing your oil. Your car seems like it's running fine until one day your engine seizes and no more car. You can avoid all that by getting your teeth cleaned regularly, and you no longer have to worry about, am I in good shape? Do I just think I'm in good shape? We can tell you, we examine you. Not to mention during our exam we use another piece of technology. We check for oral cancer. It's a cancer screening light. And over the years, in Stoneham, about 15 years, I've found 4 or 5 folks that have oral cancer that needed to be treated immediately. And they weren't even aware that they had it. We've had a big impact on their lives, we've prolonged their lives, and people have actually thanked me for finding some of the problems they had before they were even aware of them. So just because you feel fine, you may not be aware of a problem that's underlying that we can detect. This is one of my patients. We had him in last week. He's an example of someone we can get some work done on quickly. He had a problem. He was missing a bunch of teeth on one side. They'd been broken down. He had a bunch of dentistry done on them, some root canals, and he's having some pain. We brought him in. We took the roots out, placed several implants, and he walked out of the office. This is the first time I've seen him since he had the treatment done a week ago. And how are you feeling?
I'm feeling great. And I came all the way from Holliston.
So that's the kind of loyalty we've developed. People hear good things. Their friends tell them that we're the people to come see when you have a problem, and we'll take care of you.
And my neighbor's going to come to see you.
All the way from Holliston.
All the way from Holliston.
Thank you very much.
You're very welcome. Thank you.